No more locking me out of my mother's chart. I want to know anything and everything. I want to be CC'd on every chart, every post-op report, every test. No secrets.
I did want to tell you, you know.
My name is Dr. Anthony Youn, and I'm known as America's Holistic Plastic Surgeon. And on this video, we are going to watch an episode of Grey's Anatomy together, and we're going to see just how realistic is it. Is there anything in it that I think is not really up to snuff? So I'll give you my honest opinion, and I'll give you my score on a scale of 1 to 10 of just how realistic it really is.
Well, I spoke with your oncologist. She gave me a full report, and the chemo's been working. Your repeat scans came back, and they show a good response. You are her star patient.
Ooh, and the prize is a mastectomy.
Your reconstruction is going to go perfectly. It'll be my best work.
1 in 9 women develop breast cancer throughout their lifetime. There is this trend towards more and more women who have breast cancer and they undergo surgery like a mastectomy to undergo an immediate reconstruction. The reconstruction can be done in many, many different ways. In some women, we can do it using basically just an implant. There are other ways too where we can actually take tissue from a different part of the body and put that up into the breast. That will get the most natural looking and feeling result in a lot of cases, but it's typically a much bigger surgery. Sometimes we have to do something called free flaps, where we actually will take, let's say, skin and fat from the lower abdomen, and we basically remove it, take the blood vessels from that, and then hook those up with the blood vessels of the chest. It really depends on what the patient is interested in, what their medical history is, as to what they choose to have done.
Did you want Maggie here before we continue? Diane, you didn't tell her yet?
It's too much stress.
Which is exactly why she needs to know this is going to be stressful enough for you.
We're already fighting today.
No, as your doctor, I can't in good confidence continue to let this go on, all right? It's bad for you both. It's bad for everyone.
But just not yet.
When? Your surgery is tomorrow.
After. I can just have the surgery and tell her then. And I can tell her that I had cancer and not that I have it.
That's not the best idea.
This is a really difficult position to put a plastic surgeon or any type of doctor in. As a patient, it is your information, your medical history, your diagnosis, all of that is your information and your information only. But what muddies the water is when you have got family who's going to be there to take care of you. Back in the past, doctors used to shield, they thought they were doing the best for their patient, but they would shield even patients from their own diagnoses. And people would actually undergo procedures and treatments and sometimes even potentially surgery without knowing what their actual issue was. And that's still prevalent in certain societies today. Here in the United States, it's a much more open situation and much more about privacy for the patient versus, let's say, for the family. And it used to be back in the day where the families could say, hey, don't tell grandma about her diagnosis because, you know, we don't want her to get upset. Now it's the opposite. Now it really is up to the patient. And here you have the situation where a patient says, I don't want my daughter to know. That makes it very difficult when that daughter is going to be a caregiver, and it puts the doctor in a very difficult position.
So did Dr. Avery answer all your questions?
He sure did.
So you discussed everything? Even size?
We discussed everything I needed to discuss.
So what did you decide, size-wise? I just want to be prepared. You know, I've been hugging the same person for the last 30 years. You know, this is a big...
Maggie.
This is a big renovation.
Maggie, I don't want to discuss this with you. Just leave it alone.
Fine. Well, I hope you'll enjoy being a nice, self-involved, lonely person with an incredible rack.
So this is a pretty disturbing situation. Now, a breast reconstruction, if they are using actual implants at the same time as a mastectomy, typically that surgery can take anywhere from 2.5 to even up to 4 hours, depending on whether they do one side or both sides. Quite often, those patients will actually spend the night in the hospital that night. There usually are drains involved. That is in contrast to a breast augmentation, where that surgery is about 1.5 hours. No drains, patients go home an hour or so afterwards, and usually are up and doing whatever they want within 48 to 72 hours. So This is a big problem if her daughter thinks she's going to undergo a cosmetic surgery, and apparently she's not happy about it.
What the hell? Why am I locked out of my mother's file? I'm a doctor.
Yes, well, she requested privacy.
I'm her daughter. She can't handle the fact that I might have an opinion about her boob job.
She's anxious because she's going into surgery.
Now you're telling me how my mom feels, Jackson? What is going on here? Level with me. You saw what happened the last time she was here. And I thought we could actually fix it. I wanted to talk and actually try, but she has been shutting me out from moment one. Why is she doing this?
You know, I really couldn't say.
Is she embarrassed about the boob job? Why is she getting it?
She's scared about her surgery. I mean, she needs support. She needs your support.
So this is a very disturbing situation and something that doesn't typically occur in today's hospitals. So even if you're a physician in the hospital, if you have a family member who's going to undergo surgery, you should not have access to that family member's information unless that family member signs off for you on it. So if, let's say, I was a physician in the hospital, and even if my mother was in the hospital, if I went on to the hospital website and started looking up her records, I could get potentially kicked off staff, or if I was an employee, I could lose my job from this, because that is protected health information. That is okay if the family member, if the mother states it is fine to share that information with my daughter, but if it's not, for her to actually go on to the hospital computers and try to log on and try to get her mom's information and then try to coerce that doctor into giving you that patient's information, that is a complete violation of medical ethics. This is something that typically would not occur in typical hospitals, and if it does, this is something that could be sent to an actual ethics review board.
Mom? You ready to go home?
Maggie, sweetheart.
Mom? It's fine. Good luck tomorrow. I hope that your implants are everything that you want them to be.
I'm not getting implants.
It's fine.
I have breast cancer. I have breast cancer, and they're doing a mastectomy tomorrow.
What are you talking about? What is she talking about?
Come here, honey.
As a physician, these are very difficult situations to deal with, and it's not uncommon for really you to see a wide variety of ways that people deal with essentially what is grieving here. Unless I've ever been in a position like that, I don't judge anybody on how they react, because we don't know what it would be to be in that situation. I don't know what it would be to hear that my mother had, breast cancer just like that. And I think when you add in this situation the diagnosis along with the deception that she has had from her friend, her plastic surgeon, and her mother, I don't think that this is necessarily an unusual reaction.
No more locking me out of my mother's chart. I want to know anything and everything. I want to be CC'd on every chart, every post-op report, every test. No secrets.
I did want to tell you,
Okay, so this is way overstepping her bounds. For her to say no secrets and she wants to be CC'd, she is not her mother's physician. And this happens quite often in medicine, where you have a physician who believes, because that person is a doctor, that they have rights above quote-unquote normal people. And so here she is saying, I want to be CC'd on all of these correspondence. That is not her place. Her place is to be a family member, is to be the patient's daughter and to support her in that way. There actually are in hospitals rules against physicians treating family members. So at the hospitals that I work out of, if, let's say, I tried to board my wife for a breast augmentation, they wouldn't allow that. When you are treating a patient, you have to have a very clear head, and you have to make objective choices based off evidence-based medicine. If you are treating a family member, the problem is emotions start coming into play, and the fear is then you will react in a way that isn't necessarily beneficial for your patient because your mind is clouded by emotions. For her to actually say, that I need to be CC'd, she's not her mother's doctor. That is totally overstepping her bounds and something that would be completely unacceptable in today's hospitals.
The silence grows louder, ringing out in my head. But I feel it break with just one misstep down the fire escape, and suddenly I'm someone that breaks last minute man faith. Alarms will sound, it's too late for holy war now. Sooner or later the fire dies down, open my eyes again.
So her surgery apparently did not go really well. By looking at the faces of the surgeons, it looks like they probably found more tumor than they had expected. When we do these operations, typically it's the general surgeon or the oncologic breast surgeon who comes in first, does the mastectomy, takes all of the samples, and then the plastic surgeon comes in after that typically. There are times when the plastic surgeon, where they have to sit and wait. And they sit and wait in the lounge, in the surgeon's lounge, for the general surgeon to finish their part. So usually the plastic surgeon isn't necessarily in at the same time. And unfortunately it sounds like in this situation that she does not have a great prognosis. And so hopefully she does okay in the end. So if I had to give this episode of Grey's Anatomy a ranking on a scale of 1 to 10, 1 being least realistic, 10 being most, I'd probably give it about a 6.5. It was definitely entertaining, and I am very interested in watching more of these to see how she did. It's a lot of fun to watch plastic surgery on TV, and one of the shows that has a ton of great plastic surgery is Botched. So take a look at this video right up here where I actually react to an episode of Botched and a patient who wants 1,000 cc implants. How realistic is that? Find out right here.